Hello everyone, welcome back to RPIIT Academics. Today's video is all about benzine test. This test is done to see the presence of RBC, the presence of blood and hemoglobin in the urine sample. So principle behind the benzine test is that the peroxidase activity of hemoglobin decomposes hydrogen peroxide and releases nascent oxygen, which in turn oxidizes benzene to give blue color. The reagent for benzene test is the saturated solution of benzene in glacial acetic acid and hydrogen peroxidase. Then now there is a procedure for benzene test. Firstly, we have to add 2 ml of urine in test tube. Then we have to add 2 ml of 1% benzene solution in acetic acid. Shake it well. Add 2 ml of hydrogen peroxide. Mix it and observe for the change in color. Positive result will be green or blue color. If the solution gets green or blue color, it could be hematuria. That means there is the presence of hemoglobin in the urine sample. Okay, so basically what is happening over here, the hemoglobin has a peroxidase activity. This, according to this activity, hydrogen gets peroxide, which releases nascent oxygen, and that nascent oxygen converted into the benzene, and this benzene has its blue color. Okay, so in benzene test we are using 2 type of reagents. First one is saturated solution of benzene in glacial acetic acid. That means we have to take benzene in a glacial acetic acid and mix it very well, and then we need a hydrogen peroxidase. Okay, so with the help of hydrogen peroxidase, the hemoglobin starts its peroxidase activity. Now if we talk about the procedure of benzene test, that means firstly we have to take 2 ml of urine in a centrifuge tube. Then in that particular tube we have to add 2 ml of 1% benzene solution in acetic acid. After that, shake it very well and add 2 ml of hydrogen peroxide, which was our second reagent. After addition of hydrogen peroxide, we have to mix and observe the tube for change in color. So there will be if we talk about the observance, the result, there would be 2 type of result, positive and negative. Positive would be like when there is a change in color, that means when there is a green or blue color, that means the result is positive. That means the urine sample is containing RBC or the HB or maybe blood. Basically when the blood gets when the RBC get hemolyzed, they starts appearing in the urine sample. It could be because of incompatibility of blood transfusion, the hemolytic anemia, and because of some drugs which are responsible for the hemolysis of RBCs. Okay, so when the hemolysis occur in the body, that means RBC get release HB pigment, that is a hemoglobin, and hemoglobin starts appearing in the urine sample. Then we have the negative result. Negative result would be like there will be no color change in the test, and that means there is an absence of HB in the urine sample. So that was it for this video. If you like this video, then please do subscribe our channel, that is RPIIT Academics. Thank you very much.